I'm Dr. Suresh Ramalingam, Professor of Hematology and Medical Oncology and Deputy Director of the Winship Cancer Institute of Emory University in Atlanta. I'm a thoracic oncologist, and I focus on the treatment of lung cancer and research on lung cancer. Well, when we talk about targeted therapy, it's important to recognize it does not refer to one specific treatment. There are different targets that are pursued for treatment of lung cancer. EGFR is one of the more common targets, but certainly there are many other targets, and each target is associated with a specific agent. So the side effect profile vary across these specific targets. The good news is that the newer generations of targeted drugs are more specific to the cancer cell compared to the normal cell. What does that mean? Well, when we use chemotherapy, it does not distinguish between cancer cell and the normal cell. So just as we try to kill cancer cells, one of the unfortunate side effects is we also kill normal cells. That results in side effects like hair loss, suppression of the bone marrow, diarrhea, and so forth. With targeted agents, these therapies typically kill the cancer cells more preferentially than the normal cell. Therefore, the side effects tend to be relatively minor. That is not to say they don't have any side effects, but with newer and newer generations of agents, we have gotten better at specifically targeting the cancer cell. If we look at EGFR as a target, the first generation of EGFR drugs that became available approximately 15 to 20 years ago had skin rash and diarrhea as the most common side effects. With the second generation EGFR inhibitors, our hope was to bring more effective and more potent drugs into the clinical practice setting. However, more potency also translated into more side effects in the form of skin toxicity like skin rash and diarrhea. Now, the good news is the third generation drugs led by osimertinib have more targeting towards the cancer cell, and therefore the side effects associated with osimertinib are relatively tolerable and less severe. While they are similar to what you see in terms of the type of side effects, skin rash, which looks like an acne, more commonly seen in the sun-exposed parts of the body, like the face, neck, are seen in a subset of patients. But the side effects are seen primarily in the first few weeks of therapy and can be effectively and proactively managed. They are very rarely very severe to the point where one needs to reduce the drug or interrupt the treatment. Similarly, diarrhea is another side effect with EGFR inhibitors. Thankfully, the form of diarrhea we see with osimertinib is relatively mild, 1 or 2 stools of diarrhea from time to time. We tell patients to have anti-diarrheal agents with them and take them proactively. The more important thing to keep in mind is managing adverse events with targeted therapies is something that is important to anticipate and act on early on. So with your physicians and your treatment teams, to have a conversation early on about what sort of side effects should I expect, when do I call the clinic to say I'm having this problem, and making sure that I have access to appropriate supportive care measures are important. With these approaches, most of these agents can be effectively used for longer durations of time. Our goal of treating lung cancer is, if you can't cure, let us focus on keeping the disease under control for longer duration of time so that the patients can live their life with relatively minor impact on their quality of life. So improving quality of life, improving quantity of life is a major goal. And thankfully, the current age of targeted drugs are allowing for patients to accomplish those ends.